Hi guys, today we're going to talk about another article that I was reading. It's talking about active recovery from concussions. This one was done, it's actually an author's manuscript that was released in 2020, but it was published in 2018. This is done by Dr. John Leddy, Charles Wilber, and Barry Willer. So essentially the premise of this article here is it's talking about how essentially how much do we emphasize active rest when it comes to head traumas? Well, based off a lot of the current literature, and this paper here talks about a few of the more recent studies that have been done on this, is we're seeing kind of this so-called, as the article refers to it, cocoon therapy, where the patient kind of isolates themselves, pull themselves back, and tries to kind of follow that rest protocol. Well, we're starting to see that it's not really effective. So one of the things that we look at is essentially that rest within that first 24 to 48 hours. Yes, that part so far is still kind of showing to be the aspect or the time frame where you want to stay a little bit more rested. You want to give your brain a little bit more of that pullback from those extra stimuli. But then kind of following that time frame, most of the literature is kind of showing that we really want to start pushing ourselves. So one of the things that this talks about here is it talks about how when we have these head injuries, we have these changes that happen with our autonomic nervous system. So our autonomic nervous system is really separated into two systems: your parasympathetic system and your sympathetic system. These two systems are what help regulate a lot of our centralized functions. They kind of work in opposition to each other. So what we're seeing is oftentimes when we have a head injury and we try to sustain a certain amount of physical activity, our brain just can't quite handle that, whether that be from systemic breakdowns within the brain itself or more breakdowns within specific regions of, let's say, the brain stem. Either way, we're seeing with that physical exercise that there is symptoms that tend to demonstrate themselves when we push it. So from this article here, basically what we're seeing is that you do want to start pushing yourself aerobically in terms of getting that system running again, but you want to try to stay sub-threshold. So you do kind of want to put yourself back out there to a certain degree, but always keep in mind those systems and kind of pay attention to them while you're pushing themselves. Again, if you are interested in this article, I will post the link. Okay, hope you guys enjoyed.